But I want to talk about something that you may already know about or may not, but it is testosterone replacement therapy, or TRT, and how it causes infertility. Hey YouTube fam, I'm coming to you with this video from the operating room. No patients are involved in the making of this video. But I want to talk about something that you may already know about or may not, but it is testosterone replacement therapy, or TRT, and how it causes infertility. So many people may be prescribed TRT for symptoms of low testosterone. When we treat men with TRT, it's important that we counsel them that it will reduce their fertility or make them infertile. And here is how that happens. So first, to understand how that happens, we need to do a quick lesson on how hormones work and are regulated. All right, this is going to be quick and dirty. So testosterone in men are made from the testicle and the adrenal glands. The adrenal glands are small glands that sit on top of each kidney. We're going to simplify this and just focus on the testosterone made from the testicle. And testosterone made from the testicle is a result of a hormone that is produced in the pituitary gland. The pituitary gland is near our brain. And that pituitary gland hormone that increases testosterone production in the testicle is called luteinizing hormone, or LH for short. The pituitary gland also produces another hormone called follicular stimulating hormone, or FSH, and that's important for sperm production. We need to know those two. So that's the pituitary gland. The pituitary gland releases those two hormones, LH and FSH, as a result of a higher level hormone in the brain called GnRH, gonadotropin releasing hormone. So we're kind of going from bottom up, all right? So brain releases GnRH, that increases pituitary to release LH and FSH, that increases the testicle to produce testosterone. All right, you get it. Now, hormones are upregulated, meaning turned up, and suppressed, meaning turned down, by a special balance and mechanism that includes something called negative feedback or inhibition. For instance, when you get hot, you turn down the hemostat because you have sufficient heat. That increased heat made you turn down the system that brought the heat in the first place, okay? The product of your heat leads to suppressing the very system producing the heat. Same thing happens to hormones. In the same way, testosterone in abundance provides a negative suppressing effect on higher level hormones in the pituitary gland and in our brain that stimulate their production in the first place. So when you have testosterone in abundance, that will suppress LH and FSH in the pituitary gland and GnRH in the brain. Okay, hopefully you're following. So when we give you testosterone exogenously, that's the fancy medical term for we're giving it to you medication-wise, like in the form of creams, pellets, or injections, there becomes an abundance of testosterone. And that suppresses more senior hormones. It suppresses GnRH in the brain and LH and FSH in our pituitary. So lower GnRH, lower LH, and FSH all lead to decrease in sperm production. LH is important for testosterone production within the cells of your testicle, or what we call intratesticular testosterone. And intratesticular testosterone is necessary for multiple steps of sperm production. FSH is directly responsible for spermatogenesis, or new sperm production. Okay, so the end result is that extra T to the system in the form of testosterone replacement therapy, TRT, significantly decreases or inhibits sperm production. All right. How quick does this happen? How significant is this? Well, a study found that TRT can suppress spermatogenesis and lead to azospermia. That means no sperm in the semen. That's the technical term, azospermia. We see no sperm in the semen. Azospermia in 65% of men who had normal sperm counts prior within 4 months of being on TRT. Okay. Now, for many men who are done having kids or have no interest in having kids, this is largely a non-factor. All right. Great. Doesn't matter. I don't want kids, or I'm done with kids anyway. But what about the individuals who want kids in the future, but have low T and they want to get that treated? Well, in my follow-up video, I'll talk about how we can help those individuals in this scenario, but still maintain their fertility. Okay, that was the quick and dirty on testosterone and fertility. Let me know what your comments are. Like this video and share it with a friend. Share it with a friend who shares it with a friend. And as always, subscribe so you can join me every week for all things down there, right here.